All right, and we are at the top of the hour. So thank you so much, everyone, for being here today. Welcome to the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm your host for today's webinar. We're going to touch on a couple of housekeeping items before we get started. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash, who looks like she already said hi to everybody. So one of us will be sure to help you if you need it. Feel free to reach out. Please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get it answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage you to send your questions or comments to the whole group so that everyone can participate in the discussion. However, you're welcome to send a private question or comment if you feel more comfortable doing that. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use the hand clap, thumbs up, thumbs down, etc., to let us know if you like, love, agree, or disagree with whatever it is we're discussing. Reactions can be found in two places, one either at the top or bottom of your screen, and one you'll see when you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show some emoticons during our conversation. We will be conducting a few polls throughout the Zoom meeting, so you'll get a chance to interact then if you choose. And of course, remember the chat feature. Some of you may be using a mobile device, while others of you are using a laptop or computer. If you find that your features aren't the same, we just ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. So with all of that being said, before we begin today, I want to introduce our Phelps Health expert, Kim Richardson, who is a nurse educator at Phelps Health. So Kim, welcome to our program.
Oh, thanks, Paige. I'm excited to be here.
Yeah, we're super stoked to have you here. I'm really excited to learn from you and kind of get some education on diabetes. So we're gonna go ahead and start off today with a polling question. And again, these are completely anonymous, so feel free to answer however you feel comfortable. And this first question is, do you know someone with diabetes? And it's a pretty simple yes or no question. Give everybody about 5 more seconds. Alrighty, we're going to go ahead and end the poll, share the results. So it looks like 100% of people that answered do know somebody with diabetes. And I also wanted to share a fact with this as well. Let me go ahead and stop sharing. According to the Centers for Disease Control and Prevention, 1 in every 10 Americans has diabetes. And additionally, 1 in 3 Americans has prediabetes. So it's a very timely, relevant topic for us to be discussing today with Kim. So Kim, to kick us off, what's the difference between type 1 and type 2 diabetes?
Well, to start, I'd like to say what diabetes is. And it really is a chronic condition that people can have where they're not using the sugar in their blood well to make energy to do all the normal functions that we do on a daily basis. So the difference is that with type 1, people don't have enough of the hormone insulin that helps get the sugar from our bloodstream into our cells to give us energy. And usually that is an autoimmune thing. Typically you will see type 1 patients as children or young adults because it will happen early, but there are also adults that can develop type 1 diabetes. Type 2 diabetes is typically what we know of as adult onset diabetes. And that's where you may not have enough insulin, but it's also that our body can't use it well because our cells have become resistant to the insulin. So insulin acts as a key. It's a hormone that acts as a key to open the doors on the cells to let the sugar in. So if our bodies don't have enough, then not enough doors get open to let all the sugar in. And if we are resistant or those locks on the doors are rusty, then the insulin we have doesn't work. So either way, you end up having too much sugar in your blood, but not enough in the cells where we need it.
Kim, thank you so much. That's a perfect segue into question number 2. Are the symptoms different for type 1 and type 2 diabetes?
In a simple answer, no. Yes, there's not a difference because or the symptoms are similar because we have a high blood sugar. And that's usually the first thing that you will have with diabetes, is since there's that extra sugar, and they can be fairly subtle symptoms at first, because people tend to be really thirsty and you can't quench that thirst. Then they're having a lot of urination because of all that water, and your body's trying to get rid of the sugar. You can have hunger because your body is starving for energy, since it's not able to use the energy that you are taking in well. But many of those, and fatigue can be one too, but many of those symptoms can be written off as just life, or, oh, I just need to drink more water. So people can ignore those symptoms for a long time. And it may not be until something severe happens where they're really dehydrated and their blood sugar is astronomically high and they end up in the hospital before they're diagnosed. So, a lot of the symptoms can be subtle, but they're also very similar in, their presentation.
Great. Thank you so much, Kim. So question number 3, just kind of moving right along. We often hear ABCs of diabetes. And yes, I know that's the beginning of the alphabet, but what does that mean for diabetes? Can we explain that?
Sure. The ABCs of diabetes are a way to manage certain parts of your health that will also help manage your blood sugar. So it focuses on A is what's called the A1C. And that is a blood test that they can do, and it gives the average blood sugar. It gives a measurement of the average blood sugar for the last 3 months. So it's like looking in a rearview mirror to see what has happened. And so that it includes all your high blood sugars, any low blood sugars, and everything in between. So the nice thing about that is you don't have to be fasting for it. It can be drawn at any time. So if your provider is not sure of what's going on and they wanted to get kind of a snapshot of what, looking back over the last 3 months, they can see that, and that will give them a measurement of where your blood sugar will be or will have been for the last 3 months. And it doesn't show, like when patients first get seen, usually if they get put on medication, things like that, then in 3 months they'll check that A1C again, because that gives us our progress on how we're moving forward in managing our diabetes. And B is super important for everybody, because B is blood pressure. So that's something that should be checked anytime you go see a provider, either physician, nurse practitioner, PA, whatever, because that gives us a lot of information about the pressure inside our arteries. It can give us, trends on if we're doing better or worse, so that they can see how healthy our blood vessels are to try and address and control risks for heart disease and stroke, heart attack, things like that, as well as how well we're doing on our blood sugar. And then that leads us into C, which is cholesterol. And cholesterol works it works with the body to help carry different nutrients around, and the fat in the cholesterol can help with building cell walls and things like that. So it's important to have some, but we just don't want it really high. And and part of the good cholesterol, your HDL, actually helps to clean up the bad fats in your blood. And for people who have been running really high blood sugars, your triglycerides, which is another part of your cholesterol lipid panel measurement, can actually be high, because triglycerides are made of sugar and fat together. So when our blood sugar is high, our triglycerides can be high too. So without doing a blood test, sometimes just high triglycerides can help direct providers down the road to figure out that you're diabetic. So all of those together, if we can keep all those numbers in those target ranges, that's really going to help our whole body work better by helping our heart not have to work too hard, and keeping our blood vessels nice and healthy and flexible, and keep everything flowing well.
Kim, I love that. That's a really great description of ABCs, right? Now we know it's not just the alphabet.
No.
So question number 4, what does A1C mean?
So A1C, I kind of talked about already, but it's the measurement of, to put it simply, it gives us a percentage that we can correlate to an average blood sugar. So, so it actually, according to the Mayo Clinic, it says it's the test that measures the percentage of hemoglobin, which is the protein in your blood that carries oxygen, is coated with sugar. So the more sugar you have, then the weaker your blood sugar control is. So, and we can actually use that number to give us an average blood glucose number to say this is where you've been. And then there's targets where, patients without diabetes as well as patients with diabetes the goal is to be within those ranges, and that helps us know if there's good control.
Yeah, so before you get into those ranges, I want to pop over to question number 5, because that is what target levels should a person aim to hit with their A1C levels? What does that look like for every person, or is it different?
It is different. So for someone without diabetes, then they would expect your A1C to be 5.7 or less. Because what that means then is that when you eat something and you have sugar that goes into your blood, your body is able to respond to that sugar appropriately and get it into the cells and into the muscles so that it can be used up as energy. And because we know that people with diabetes have a harder time utilizing the sugar in our blood and getting it used up as energy, the expectation is for them to be in the 7% or below range, and that would be considered well-controlled diabetes.
Great, awesome. Question number 6, do target levels differ for men and women, and are they also dependent on age? What does that look like?
So actually the targets are the same across men, women, and age groups. The only difference would be if someone was diabetic while pregnant, and then the target levels are a little tighter because we know that too much blood sugar can affect how quickly the baby grows and how large the baby grows, which can put pressure on the mom and cause delivery issues. So, but otherwise, for men and women, young and old, the target ranges are the same.
Kim, that's great information. I didn't know that. I've never had kids yet, so I'm like, that is really great information to know. Thank you so much. Question number 7, what happens to a person's insulin levels if they have diabetes?
So that's a really good question because there's a couple of ways to answer that. So it kind of depends, like I talked about at the beginning with the differences between type 1 and type 2. Each person's function is a little different. So typically with a person with type 1 diabetes, they have either no insulin or very, very little insulin. So since insulin is that key that opens the doors on the cells to let the blood sugar in, there's not enough keys. So you have all these doors that are locked and there's no way to open them. So that's why someone with type 1 diabetes has to take insulin, because it replaces what their body can't make. And then with people with type 2 diabetes, it can be a combination of either not enough insulin, so their body is just worn out from producing too much insulin for too long, and also that their cells don't respond appropriately to the insulin to let the sugar in. So you have plenty of doors and you may have plenty of keys, but the locks are rusty and the keys aren't working very well, so that it can actually decrease the amount of doors that work on cells by 20 to 25%.
Wow. Kim, you had mentioned before blood sugar levels. I want to round back to that. Oh, give me just a second. There we go. What is a normal blood sugar level that people should aim for?
So depending on the lab, typically for a person without diabetes, their fasting blood sugar, meaning nothing to eat or drink for 8 hours. So first thing in the morning would be 80 to 95 or 100. And then, but those targets changed with just like the A1C does with people with diabetes, because we know that with that inefficient use of insulin and sugar, it's going to be a little higher. So to be considered well managed, we would want fasting between 80 and 130. And then anything 2 hours after the first bite of your meal would be 80 to 180.
Great. Question number 9. Why is it essential for a person with diabetes to measure and monitor their blood sugar?
So there's so many things that are affected by your body if your blood sugar is not good. And it can be challenging to get people to understand that managing your blood sugar is so important, but because it can be so overwhelming. But really, if you, there's lots of long-term complications like kidney disease and problems with your nerves in your feet and your hands, and blood vessel issues that can lead to hardening of your arteries and heart problems and stroke, and even sexual problems and depression are higher with people with diabetes. But you're gonna just feel better if you manage your blood sugars well, because typically if your blood sugar is running really high, you're gonna be really tired, and it's that so tired you can't pick your hands up off your desk tired. And so it makes it just hard to go through life. And if your blood sugar is really low, you can be shaky, and I like to call it hangry, where you just are irritable and angry and need food. So your mood and just your day is going to go better if you can manage your blood sugars and keep them in a healthy range.
Kim, I love that you use the word hangry, because that is common language in my household.
Oh, it speaks to my soul.
I'm very food motivated.
Yeah, me too.
Question number 10. What are the warning signs if someone's blood sugar is too high, and what can someone do if their blood sugar is too high?
So some of the symptoms can be similar for both high and low, but typically for high blood sugar, you've got that insatiable thirst, and you've got frequent urination. You may be hungry even though you just ate. That fatigue I talked about. And so the best thing you would want to do at that point is just drink water, because drinking water is going to help your kidneys flush out the extra sugar. And another thing that can really help your body use the sugar is easy, light exercise, like going for a walk. That's why going for a walk after Thanksgiving, a big Thanksgiving meal, is good, because it helps use up all of those mashed potatoes and stuffing and pie that you had, so that your blood sugar is not so high.
I loved that you use Thanksgiving food as your example. You don't even have to say it's Thanksgiving. I just know.
Yeah.
Question number 11. Should a person with diabetes keep a journal that tracks their numbers and their health, such as how they felt that day?
Yes, definitely, because everybody will react a little differently to different foods or stress or things like that. So it's great to be checking it and having it in your meter, because at least you have a record, but writing it down in a logbook with a note about what you ate, or if you had a really high stress day, can really help put those pieces together to give you that ability to manage your blood sugar well.
I love that. Yeah, I'm a huge fan of journals. I keep a couple of different journals. I keep one for behavioral health, so like my mental health and wellness. And then I also keep one just for my physical health, just because I love data and I love to track those things over time.
Well, and it's great because you can, when you're in the moment, sometimes it's hard to figure it out, but then you can look back and you'd be like, oh, that makes sense. And so not only could you do it like in a journal or in a logbook, but there's lots of apps on your phone that you can use to track things too, so it's easy and handy.
Hmm. Yeah, MyFitnessPal is a great one
Mhm.
for just food, if that's something that somebody wants to track.
Yeah, and that's a great one.
So question number 12, let's say I'm a person with diabetes. Do I need to take my medicine every day, or, can I just take it when I'm not feeling good, Kim?
So just like I mentioned it before, how it's really important to be consistent. So consistency not only with how you're eating, but with taking your medication, because some medications take a while to build up. And so then they need to be taken consistently so they can work the best. And if you were only taking your medications once in a while, if you didn't feel good, you're not going to get the best results from that. And you'll end up being on a roller coaster where your blood sugar goes high, you take your medicine, then it goes low, and then you're low, so you're going to not only will it help manage your blood sugar better, but it's really going to help you feel better to just be consistent with it.
Love that. Great advice. Question number 13, and you kind of mentioned this before a little bit. What are some of those most important things to check or measure at doctor's appointments?
So we talked about blood pressure, and that should be checked at every doctor's appointment, because the not only spot checking and knowing if you're high at this very second is important, but seeing the trends. If you've been slowly coming up and your blood sugar is, or your blood pressure is starting to run high more often, can be an indication to get on medication, or talk about other lifestyle changes you can do to help with your blood pressure. And your provider, if you do have diabetes, would want to see either the sugars on your meter or your logbook to see what your trends have been for that too, to give an idea, since we know that we won't be drawing blood except maybe every 3 to 6 months for the A1C and those kind of things. So if you're seeing your provider more often, that will give them a hard data to see how you've been doing. And one of the things we worry about with people with diabetes is that because of the inflammation that's going on already with the blood sugar, then you can run into problems with your skin and having wounds that don't heal well. And typically feet can be a big area that is missed when we're taking care of ourselves at home, because we just take our feet for granted. They've just been there all the time and they're just going to always be there. So taking your socks and shoes off and having your provider check your feet just to make sure everything looks healthy, make sure your sensation is good, is important, because if we can catch those complications early, then there's a lot better chance that we can minimize the impact on your life.
I love that. Fantastic. So this next question is one that I think is really important. If diagnosed with diabetes, should a person stop smoking? Smoking comes up across the board in all different areas of our life.
So yeah, smoking is not your friend. You may enjoy it, but smoking contributes to a lot of complications, not only with your heart and with your circulation, but if think about your arteries and your blood vessels as hoses that run throughout your body, that the pipes that are letting all the energy, all the nutrients circulate throughout your muscles and organs. So if we smoke, they get smaller. It shrinks those down. So then there's less space for all the nutrients and everything to go through. And that is why people who smoke tend to have higher blood pressure, because there's still the same amount of fluid, it's just in a smaller tube. So it ends up being like a fire hose and there's a ton of pressure. And so if you add in high blood sugar to that just increases that pressure, and it actually makes our blood thicker. So then it's like real high pressured syrup going through your veins. And that is not healthy for us at all. And so that increases your risk for circulatory complications like, kidney problems, eye problems. It also puts more pressure on our heart. So it can increase our risk of heart issues or clogged arteries and heart attack, stroke, things like that. So anytime anyone asks me if they should stop smoking, I'm going to say yes. But for sure, if there's any diabetes associated with that person, it's super, super important to stop as best you can to help minimize those problems.
Great, Kim. Thank you so much. Question number 15. Let's say somebody has diabetes or I'm somebody with diabetes. Can I reverse my diagnosis if I just stop eating carbs or if I lose a ton of weight?
So everybody needs carbs. Our brains prefer carbohydrates because carbohydrates as foods get broken down into sugar, and sugar is the preferred fuel source for our body, especially our brain. So even if you are a person with diabetes, you still need carbohydrates throughout the day to help keep your energy levels up. And this question comes up a lot about, oh, I'm not going to have diabetes anymore, or I'm going to get rid of it. And those thoughts are great. And the motivation behind it is awesome, but it's kind of like, I was talking to a patient that had, if you have an underlying asthma, you can be really well controlled with your asthma. But if you have a trigger, like you're out camping and a bunch of smoke gets in your lungs, that can trigger your asthma. So even if it's well controlled, it's still there. And that goes with diabetes as well. There's no cure for diabetes, but you can have your diabetes be in remission. And what that means is that your numbers, your A1C, your blood sugars are all well within the targets of a non-diabetic. You are probably not on any medication except maybe one, metformin, which is a pretty standard one, so that you can be considered in remission. And so even people who've had weight loss surgery, who lost a ton of weight and their diabetes went away, it's still kind of there in the background, because if they were to gain the weight back, or they decrease their activity, or a big stress on their body like surgery or something like that, then they could end up having higher blood sugars as a result.
So this is a perfect segue into my next question as well. Can someone with diabetes eat fruit as a part of their diet? Because a lot of people associate fruit as carbs.
Right. And, there's that Freestyle Libre commercial that I see all the time about no this and no pizza, no that. And that's the first thing everybody thinks of is, oh, I can't eat white foods, or I can't have fruit, or I can't have any sugar. And there is no off limits foods when you're diabetic. The key is portion size as well as combination, because if we are having a balanced diet where we have consistent carbohydrates throughout our day paired with proteins and fat, then it really helps keep our blood sugars more stable. So fruit, cake, pumpkin pie, all those things can be integrated into your diet appropriately and be successful with your management of your diabetes.
I love that. I love hearing that too. Again, on the cusp of, holidays coming up, it's really important that we have these conversations, because I think just in general, we often get in the mindset of, oh, I can't touch that, or I can only have one bite. Well, that's not necessarily true. Let's just have a conversation about moderation and what that looks like for you.
Yeah. And food is so much more than just fuel. It's a cultural connection. It's social. It's so important in just how we get through our day-to-day life. And so I'm not willing to give up that in my life. And so I'm certainly not going to expect anybody else to. So then my goal is to try and find ways to help integrate the foods that you love with the people that you love, and still meet those goals and those benchmarks to keep yourself healthy.
I love that. So we're going to skip over question number 17, since we've already kind of talked about carbs and what that looks like. So question number 18, should someone with diabetes avoid fat altogether?
So fat is important because that helps our cell walls. We use it in building our cell walls and lots of other things in our bodies. It helps to carry certain vitamins and nutrients. So you do need fat. And again, with the carbohydrates and proteins, you still want to have that moderation. So trying to get healthy fats in there and minimizing, saturated fats from like junk food or fast food, things like that, can help you still get those yummy foods and get that feeling of fullness and satisfaction when you eat without overdoing it.
I love hearing that. So Dr. Yulo, he's one of our doctors at Phelps Health as well. He is a huge advocate of this as well, Kim, because, he loves burgers from McDonald's. Like, who doesn't dependent on the day and situation, right? So he's not going to tell somebody, no, you can't go have this McDonald's hamburger instead of having 3 Big Macs. Let's talk about like 1 kid's junior size cheeseburger.
Right.
You know what I mean?
Yeah.
No, I think that's awesome.
And getting in touch with yourself when you're eating it and paying attention, because I think a lot of times we're distracted, we're working or we're watching TV or we're doing other things and we're eating and we're not thinking about what we're eating. But being present with what you're eating and noticing, savoring it is going to help you enjoy what you have, usually in a smaller portion. And then paying attention to when you're full, when you're, those kind of things is important too, because then when you can address those issues, then a lot of times having smaller portions or changing up like the quantity of what you eat can be a little easier, because you're like, you know what, I ate what I wanted and that was enough. So, that part of it too kind of plays in, because if we're paying attention to what we're eating, then that can help you meet those goals a lot easier.
Kim, we had a question come through that I want to ask. So if somebody is new to diet or weight management for their diabetes, what are some first steps for them for smaller portion sizes?
So I would say first they should get a referral to come see us in diabetes education, but to get started, because there's so much information out there and it's contradictory and it's overwhelming. So really, the American Diabetes Association has great resources to give you ideas. Reading your nutrition labels can help you balance how many carbohydrates you're getting. So you still want some carbs, but you always want to have protein with them. So that way it helps you not spike your blood sugar. It helps the sugar actually last in your body longer to give you, so you can use more of the energy. Going to a smaller plate, so like a 9-inch plate instead of the giant ones that we have, can help you have smaller portions, but still look like you're getting adequate food, because we eat with our eyes as much as we eat with our mouths. So that's important. Or you could say you went out to a restaurant for dinner and we know portion sizes tend to be out of control. You can have your waiter just split your meal in half and have half now and then save half for later. And that will lower your portion size. So there's lots of little things like that can help, without going totally crazy on trying to follow all these perfect steps, just making sure that you're following your nutrition labels. If it says you get a bag of nuts and it says there's 6 servings in there, well, you don't eat the whole bag in one sitting because that's too much. So things like that can help, at first to get a little more control of your life.
Your idea of going into a restaurant and having them split up your portion sizes is a phenomenal idea, because I often find that I only eat half my food. So why don't I just proactively have them box it up? Yeah, that's a great idea.
And usually, you're like, you eat what you have and it's enough, because there's so much.
Yes, I love that. That's a great idea. I'm going to start doing that, Kim. Thank you. What are some good travel foods for people with diabetes?
So that can be a challenge, especially, talking about eating in restaurants and things. I'm a huge proponent of snacks. I always have been. You can ask my daughter. We always have snacks wherever we go. And so it's real important for me to always have good things that I can eat. And you can find good, trail mix is a good one, because you've got your protein and your fats with your nuts, and then there may be some dried fruit in there, or maybe even a little chocolate. So that'll give you a good balance of carbohydrates and proteins. Things like cheese sticks and meat sticks and, things like that you can find in convenience stores. A lot of times you can find fruit in convenience stores or bars. You can get a lot of different protein bars that aren't necessarily super expensive, that will give you some sugar or carbohydrates along with your protein to help keep you full. Veggies tend to travel well. So like carrots and celery and even broccoli and stuff like that can be put in like a little Ziploc bag, and you can munch on that to get some good fiber and nutrients. So I really think at this point, there is a lot more options, even at like convenience stores, to pick up healthier foods instead of just candy bars.
I love that. Great options. Yeah, I'm a huge fan of protein bars whenever we go and travel, because my first gut instinct is, let me go grab a bag of Funyuns or whatever it is, but I'm like, that's not actually going to fill me up, and then I'm going to be hungrier because of it.
And sometimes you need Funyuns, so then grab a string cheese too, and that might give you enough to keep you full longer.
Yeah, it's all about balance, right?
Mm-hmm.
So we're going to do another polling question, and then we have a couple of more questions to wrap up today. So this next question, and again, completely anonymous, how likely are you to seek out resources to help manage your diabetes or that of a loved one? So not likely at all, somewhat likely, pretty likely, very likely, or prefer not to answer. And again, these are totally anonymous. Give everybody about 10 more seconds. All righty. Going to go ahead and share those results. So this is not really what I expected. So we have a few people that maybe they wouldn't be likely at all to seek out resources. We have some people that are kind of on the fence. And then we've got a couple of people that would absolutely seek out resources 100% of the time. So this is great. I'm so glad that everybody is here to participate in this conversation and to have Kim give us some information about what it would be like to work with a nurse educator, a diabetes educator. So question number 20, what resources are available to help someone manage their diabetes? And we're sitting here talking to one of them right now.
Yeah. And, there's the great thing I think about this area is the fact that we have this diabetes education program, because it is such a huge thing to kind of wrap your mind around when you get a diagnosis of diabetes or prediabetes. So a lot of people will call or come in and they're just like, I don't know, because I go to this website and it says this, and and then there's all these, eat an onion and your diabetes will go away, and so much information out there, and a lot of it isn't true. So I think not only talking to your physician, your nurse practitioner, your PA, whoever it is you see on a regular basis, they're a great starting point. The hard thing about them is that since visits are scheduled so close together, there's not a lot of time. So they can kind of get you started. They can put in a referral to see diabetes education to help get more information. And the nice thing a lot of people worry about the cost. And so most insurances do cover diabetes education in, one way or another. And then there's also free classes that we've started offering once a month to kind of give survival skills for people who are pre-diabetic, or they're newly diabetic, but they have a really high deductible, or, underinsured or overinsured. So we try and not only get the information out and support the people who may get the traditional referral to come in, but also the other people who would really benefit from the knowledge. And there's lots of good information out there. So starting with like the American Diabetes Association, and their website has great information about, parents helping their children with diabetes, or women who are pregnant with diabetes, or adults who have new diagnoses. There's so many things. So, American Diabetes Association, Mayo Clinic, certain, even the CDC, National Institute of Health, those can also direct you to good information that you can use that can actually be helpful for your life.
I love that, Kim. Thank you so much. So you already kind of answered question number 21. What are some resources? But we did have some really great questions come through, and I want to give us some time to talk through some of those as well. So this question that came through in the chat was, somebody has a family member who has been a diabetic type 1 for over 50 years. And their question, it's twofold question. The first one is it possible for somebody's body to get used to insulin? Their family member's insulin doesn't start kicking in about 2.5 hours after taking the fast acting, and it lasts for 6 to 7 hours.
So it's very common over a long, if you've had diabetes for a really long time, it's very common to, even if you're type 1 and so you've needed insulin because you don't have enough, as we age, our body does become more resistant to the insulin. So that could be part of the reason why. It's not that they're getting used to the insulin, it's just that their body doesn't want to respond to the insulin. So, tracking sugars and either carbohydrate counting or, counting carb choices, and then taking that data into your physician, nurse practitioner, physician's assistant, whoever you see, would be a good starting point to discuss if that person needs to change and have more long-acting insulin. So it's just that's constantly working around the clock, and maybe a different type of short-acting insulin, because there are some that work like immediately. There's inhaled insulin. There's lots of options now. So it could be that maybe a different type would work better for them, or a different combination. So that's why it's important to bring that information into your provider so that you guys can discuss, what you think will work best and how to move forward to get those blood sugars managed better.
Kim, that was kind of the second part of their question, is who do they see to have this discussion, and maybe what do they even bring? So it seems like you were able to answer that as well, and you just didn't know it. So we've got one more question before we wrap up today. You had mentioned wound care. What's the correlation between wound care and diabetes?
So anybody who has diabetes has kind of a chronic inflammation in their body, just because things aren't working right. So everything is a little fired up, so then if you introduce an added stress like a wound or a surgery, then it can make the healing take longer. So not only are they maybe a little immune suppressed because their immune system is just constantly working, so it's a little tired, so it might be a little weaker than someone else. They also don't heal as fast because everything is a little slower, and the extra sugar can inhibit how well you heal. So that's why it's so important to be not only aware of how your blood sugars are, but how your skin is. And, a lot of providers recommend seeing a podiatrist, especially if you're getting older and you can't get to your feet easier. And if you have thickened toenails or any problems like that, having a podiatrist trim your toenails is going to be safer to help minimize those risks of having injury, because the body parts furthest away from our heart are what suffer the most when it comes to poor circulation. So that's why toes and feet can be the biggest problems for people with diabetic. And if they do end up having big complications, the amputations usually will start there. And that's why there are people who, if they have had diabetes for a really long time and it's just been really hard to control, or they haven't tried to control it, then they can end up with those circulation issues that they end up having amputations. And some of that can even start because of a wound that wasn't taken care of.
I love that, Kim. Thank you so much. Really, really great information. And you may have already mentioned this, but I want to make sure we touch base on this. How can somebody get more information about diabetes education? What's the phone number that they can reach you at, or do they have to get a referral?
So anyone is welcome to call to get information. We're glad to help people over the phone. And my number is area code 573-458-7697. And, I have voicemail. So if I'm off, if I have an appointment where I'm working with a participant, then you can leave a message and I can call you back. But if you are a person who has diabetes, then and you wanted to get more education, you could talk with your provider and see if they would send a referral in. And then that way, because our standard education program is actually 10 hours of instruction. So we cover, everything from what is diabetes to meal planning and healthy eating and all those things. So we can really spend time discussing things instead of just the 15-20 minutes you get with your doctor because they have 20 other patients to see. You have that time to ask your questions and get the answers and have explanations that make sense to you. But then we can also tailor it to if there's just specific things you need that you're interested in, we can go from real broad and cover everything to really focused if all you want is the healthy eating portion or how to deal with your insulin or anything like that. We can really customize our education to any patient's needs.
I love that, Kim. Thank you so much. So to kind of wrap us up today, first, thank you so much, Kim, for the wealth of knowledge that you are. It was such a pleasure having you on the Scope at Lunch.
Well, thanks for having me. This has been fun.
You'll do it again, right?
Sure.
As a reminder, the show has been recorded and will be emailed to participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you liked the show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day, everyone. Thank you all so much for being here.
Thanks, Paige. Have a great day.
Thanks so much.